Today we're going to talk about an anxiety disorder. Anxiety is an emotion characterized by feeling of tension, worried thoughts, and physical changes like increased blood pressure. People with anxiety disorders usually have recurring intrusive thoughts or concerns. They also feel upset, uncomfortable, and tense. There are 7 types of anxiety disorders. First is the generalized anxiety disorder. It's all about worries, especially for unrealistic worry about everyday things such as health, family, friends, money, or career. Then it comes to agoraphobia. It is an anxiety characterized by fear of being in places or situations that may be difficult or embarrassing to get away from, or the fear that help might be unavailable if needed. It's a panic disorder, with and without agoraphobia. This disorder is when you experience extreme panic attacks in situations where most people would not be afraid. In the specific phobia, we will extend the topic by tomorrow. I will talk about simple phobias and complex phobias. Specific phobia is an extreme or irrational fear of an aversion to something such as the fear of heights, water, dogs, cold spaces, snakes, and spiders. Social phobia. This phobia is a strong and persistent fear of social or performance situations, and you will have the fear of being negatively judged by others. Obsessive compulsive disorder or OCD. This disorder involves constant unwanted thoughts, and you will try your best to banish these thoughts. Post-traumatic stress disorder. This disorder is for people who experienced major trauma such as war, torture, vehicle accident, fire, or personal violence. You will feel terror for a long time even after the event is over. Not everyone who experienced trauma receives PTSD. People repeatedly relive the traumatic event through nightmares or flashbacks. People with one anxiety disorder can develop another and also experience depression.
Okay. So the causes. What causes this anxiety? What happens? Like, why does this even happen? Um, the first thing that is a well established. Um, that's well established that the tendency of you getting anxiety um runs in the family. So genetics, just like diabetes can be caused by genetics, just like heart disease can be caused by genetics. Um, these are blood disorders. Your Yeah, a brain disorder, a mental disorder can also come in the form of genetics. Um, so yeah, so maybe if the father a father has like your father has anxiety disorder and has lots of issues, maybe it can run down to the family and it always happens to you. The traits of your family are always put on you. Next slide. Biochemical factors. So as you may know, um, the most of the brain's function happen in chemical reactions that happen throughout your brain. Um, it can be caused by um, chemical imbalance in the brain, where the neurotransmitter, the part of the brain that regulates your feelings and physical reactions, there's some chemical reactions that happen in the brain that aren't supposed to happen. And what ends up is you get anxiety for things, that you shouldn't get anxiety for. You get stressed real quickly just because of a malfunction that happens in your brain. Yeah, so chemical reactions. Okay, so this is the neurotransmitter, this small thing that's located in your brain. This is the thing that um, releases all the it regulates the feelings that you have. It controls the feelings you have. Um, there's chemical reactions that could happen that could lead to you're getting the anxiety disorder. Next slide. Um, what another thing that could possibly cause anxiety disorder is temperament. This I would say, this is my saying, my opinion. It really depends on the society or community that you live in and how you're treated. Maybe let's say a person gets bullied gets bullied from elementary all the way to high school. After high school, he'd be really afraid to talk to people or meet people, and gets a lot of anxiety while approaching people because he gets bullied. So yeah, temperament. If you have high temperament, for example, you're more prone to get anxiety disorder. People who are easily aroused and upset and are very sensitive and emotional are more likely to develop anxiety disorder. So yeah, I would say this is mainly caused by your past and the community you were raised in. People who, as children, were inhibited and shy and may be prone. Phobia is a big thing that is developed around the world. Next slide. Alert response. Some people exposed to situations, people, or objects that are upsetting, or anxiety arousing may develop an anxiety response. So basically, you've got it maybe in a situation that was, let's say, you were in a program and you got called on to say an answer and you didn't know that answer. And every time you think about this situation, you get anxiety because it was such a horrible experience that you don't want it again. And even if you think about it, you just get anxiety because of it. Your brain doesn't want, it's telling your body um, to be scared of this. You don't want this to happen. Um, so thinking about it can cause you to possibly get anxiety disorder. Next slide. Stress. Okay. I would say for me personally, it's pretty relatable. Um, let's say you are attending online school and you are a 12th grader and you have 50 applications to make, and above that your teachers are always giving you homeworks to complete, and you have a lot of stuff to do and you don't want to get an F in any of your subjects, and all of the stress that you're developing and you possibly not going out with your friends and everything that happens could possibly cause an anxiety disorder because of all the stress you have in your life. And yeah. So yeah, this is one of the causes of anxiety that could possibly happen. Right on the side. If somebody gets anxiety disorder, is it treatable? Like, oh, somebody's always anxious. What can he possibly do to avoid or um, resist these conditions? Um, it is very effectively treated all around the world. Although each disorder has its own specific characteristics, maybe somebody has a phobia, maybe a past experience, maybe somebody hasn't had any good experiences, so he doesn't want to experience anything. Um, each disorder is very specific to that specific person. Um, so the psychological um, treatment or medication, it could be different for each one. Next slide. Um, is what treatment is available. Um, there's a lot of possible treatments. As we said, there's a lot of different conditions. Um, treatments for anxiety disorder include the following. Therapy may evolve gradually, um, exposing a person to situation that trigger their anxiety. Desensitization. Okay, let's say the COVID vaccine, for example. What they do is they expose you to this certain vaccine, so you don't um so if they expose you to this a similar virus, so when this certain virus, this dangerous virus comes, um it doesn't scare you anymore. The same thing happens um during therapy. Maybe this specific experience gives you anxiety and you're really uncomfortable in your experience. What they do is they make you experience this experience. I'm saying experience too much. um and then when you experience it, um yeah, you're not scared of it anymore. Oh, things are okay. I'm doing this thing and nothing is happening. Things are okay. I'm not. I shouldn't, why was I scared in the first place? And that's one strategy of therapy that they may use um to hopefully um solve this. Another example would be, like, for an example, um let's say somebody doesn't want to approach people. He wants to make new friends, but he always gets anxious when he meets new people. What they'll do is they'll make him deal with people on purpose, and let's say they tell this person to be accepting of the guy with anxiety disorder. And if he meets him and he figures out, okay, it's okay to meet people, they're not always going to fight you, he will hopefully this anxiety disorder will hopefully be resolved. um Anxiety management and relaxation techniques like yoga and meditation and everything like that help fix the situation. Next slide. Any questions so far, or is everything clear? I can come to as soon as everything is clear. um Antidepressants play an important role in the treatment of some anxiety disorders, as well as treating associated or underlying depression. Um, Antidepressants. I would say antidepressants are things that fix your mood. Let's say a good song that you like to hear that always gets you in a good mood, or a sport, a hobby that you play.
Antidepressants is a pill.
Oh, it's a pill.
Yeah,
Okay, that's nice to know. Thank you, Yusuf.
I got
So yeah, antidepressants could also help. Um, anti anxiety medication. That specifically influences the neurotransmitter system in the brain, or sometimes just 1 second. Um, anti anxiety medication that specifically influences the neurotransmitter system in the brain are sometimes useful. Medication will not cure anxiety disorder, but can keep symptoms under control while a person receives psychological treatment. Okay, so yeah, they don't want this guy to be insane, to go insane. So they give him medications that just decrease the symptoms while he is going through treatment. Next slide. Um, Family and friends of people with anxiety disorder can often feel confused. The can often feel confused and distressed. Support and education, as well as better community understanding, are an important part of treatment. Basically, if a guy has anxiety disorder, he should um, go with people that he feels comfortable and that are supportive and understanding of his condition. Not supporting of his condition, that are understanding of his condition and will support him, give him extra support because of the condition. So yeah, um, I guess just go with people that you're comfortable with. If somebody makes you uncomfortable, don't go with him because that is maybe even more harmful to your condition. Why am I talking as you're the patients? If a person has anxiety disorder. All right, next slide.
Okay, that's the end of the presentation. Thanks for your attention.
All right,